Using the barrier concept, see how far her knee falls out to the side, external rotation, internal rotation.
Osteopathic philosophy states that all parts of the body function together in an integrated manner, and if one part of the body is restricted, then the rest of the body must adapt and compensate. When the body's free of restrictions in movement, osteopathic treatment assists the body with pain minimization, reduced stress, and greater mobility, providing the body with an opportunity to heal itself. How great is that? Let's learn some more.
Osteopathic manual treatment starts usually with a static view of the patient, looking for vertical lines, plumb lines, and horizontal lines, looking for asymmetries of structure. I'll have you turn and face that way. Again, looking at the plumb lines in 3 planes, her ear over her shoulder, shoulder over her hip, hip over her knee, and over her ankle. Osteopathy was developed by a Civil War frontier surgeon. His name is Andrew Taylor Still. He went through a lot of tragedy in his life, and he was very concerned with the misuse of drugs, which basically in those days were opium and alcohol, and the addiction to them, and the fact that they didn't work very well. He had some family tragedy as well. 3 of his children died of meningitis, and being a medical doctor, he felt helpless to save them. So he furled the banner of osteopathy in 1872, and it's a manual approach, drug-free treatment, and he believed that the body was like a mechanism, and if it was out of place, if the parts didn't work properly, then sickness would ensue. One of his quotes, he had lots of little quotes. One of them was, disease is only so much dirt in the wheels of life. Have you turn your chin over your right shoulder, chin over your left shoulder. Look straight ahead. Drop your right ear to your right shoulder and left ear to left shoulder. Straight up. This is the dynamic part of the evaluation. So osteopathy is based on principles, not techniques, at least the osteopathy that I've learned. And the principles is the body is a unit, and I see that as self-evident because we all come from a single egg. Structure and function are interrelated on all levels. So the shape of a bone, the shape of an organ, the microscopic tissues, their structure determines their function, and the function also determines the structure. And the final principle is that the body is self-protecting and self-healing. And the 4th principle, he put it all together and he says, rational use of all this knowledge is what makes osteopathy work. So now the body is off gravity, well, off vertical gravity, and that takes the body mass off the facet joints in the spine and off the pelvis. Again, looking for levels of our anterior superior iliac spines, rotation in our lumbar spine. In osteopathy, essentially I tell my patients I move every joint in your body and see how it moves. And if it doesn't move well, I try to figure out why.
My understanding is also that it works with not just the physicality of the body, but also with what we might, in different practices like yoga and qigong, refer to as life force energy. How does that component come in with osteopathy?
Well, Still believed that the human was triune, mind, body, and spirit. I find in my own practice, pain can be a very emotional state. And so a lot of the approach of osteopathy is calming and soothing. It can be very spiritual, but that's not what I try to impart any sort of belief system in my patients. I just want them to believe that it works and I can help them. This is a fairly complex motion where I'm opening and closing the SI joint, feeling for the quality of movement in the hip joint, and feeling for restrictions and asymmetries.
A lot of it is manipulation of the joints and the musculoskeletal system.
Yes.
How is this different from chiropractic?
Again, that could be a very, very long discussion, and with the chance of getting myself in some hot water, I've done quite a bit of research and come to the conclusion that chiropractic is actually an imitation of osteopathy. Osteopathy was around first. The first school was opened before chiropractic was ever declared. And in my research, I've seen that David Daniel Palmer had actually gone to Kirksville, the first college of osteopathy, never enrolled, and then several years later declared chiropractic. An inside roll, this is a really good position to assess the spine, especially the lumbar spine. And this is motion testing as I go through each segment, feeling for the quality of the motion or restriction of motion. I think one of the most important things is that osteopathy is not just mechanical and it's not just musculoskeletal. In some jurisdictions, and I know they're having a struggle in England, where it's been regulated to the point where they just basically act as physiotherapists and they can only do, their scope of practice is so narrow. Right now osteopathy is not regulated in Canada, and I treat symptoms of all kinds of allopathically diagnosed diseases, but I treat them structurally, but I also treat them viscerally, and it works very well for things like irritable bowel, for menstrual problems, breathing problems, headaches, migraines. I got one woman was on morphine, and now she's no longer on morphine, and she controls her pain with ibuprofen.